Another big topic about this is just, why am I here? Why am I educating? Why am I in Miami right now and educating these doctors on what it is that I'm doing? And I spend an exorbitant amount of my time after hours outside of my clinical life mentoring, because everybody needs to know about this. People don't see their PCP on a regular schedule like we grew up with. They'll pop over to a Ready clinic and get a strep test and get an antibiotic for something. And that relationship is so different than I feel like it was when my parents grew up and who their doctor was. And it's different in dentistry. The patients that are really paying attention and coming to their cleanings every 6 months and coming to see us, it's my job to make sure I don't miss something like this, because if they're not seeing somebody else that's specifically looking for it, it's going to get missed. And I provide very simple steps for the doctors that want to learn about it, of screening and making it as feasible as possible to put into their patient exam. Because when you find something like sleep apnea or central sleep apnea or a Chiari malformation in the brain from a sleep test, and you caught that before that patient had a heart attack or was already in their late 60s, that's a game changer. And my patients are just so appreciative. Like they trust me, and I would never, ever break that trust. And they send their parents to me and their family members and their friends. And I think the more dentists that can be paying attention to the signs of sleep apnea and sleep disordered breathing and upper airway resistance syndrome, and the better that they're going to feel when they go to sleep at night, no pun intended. And I just think that education is key. And that's why I take time away from my kids and my family and the practice to come here and talk about this, because it was just a couple of really important lectures for me that I went through and sat in a couple of years ago that changed everything for me, everything. And if I can provide that back to those providers and help that person that's going to come in and see them, and that little child that's going to be sitting in their chair, and they've got new eyes for it, then it's a win-win for everybody.